Now that we've reviewed basic physics, let's discuss knobology. There are many different buttons on the control panel of ultrasound machines, and initially the number of buttons can seem overwhelming. Let's review the most important buttons on the next few slides to improve your understanding of ultrasound. The picture on this slide is of a control panel. The next ultrasound machine you use may have a control panel that looks different. What is most important is that all control panels have very similar buttons and knobs, and these buttons and knobs have the same functions regardless of the kind of machine you are using. Let's start. First, a quick overview of the important buttons, and then we'll discuss them in greater depth. The power button is the most important button of all. You'll never be able to obtain a great ultrasound image if you don't know how to turn the machine on. The modes button helps you to switch between B mode, M mode, and different Doppler modes. The freeze button freezes a desired image on the screen. The save button saves your frozen image. The clip button saves a desired video clip. The depth button adjusts the depth of your image. The gain button adjusts the brightness of your image. The zoom button magnifies a selected area of your image. Calipers are used to measure a particular structure, such as the diameter of the aorta or gallbladder wall thickness. The gain button allows a sonographer to adjust the brightness of returning echoes. The gain control affects the brightness of the image by adjusting the amplification of the electronic signals after the echo has returned to the transducer. Increasing the gain makes the image brighter, and decreasing the gain makes the image less bright. Sonographers tend to want to use more gain to see an image better, but overgain can result in loss of subtle but important information in the image. This image of the right upper quadrant has perfect gain. You are able to see the detail in the image quite well. However, this next image has too much gain. It is too bright, and the detail of the image is obscured. This image is too dark and has too little gain. The image detail is also obscured in this image. Let's review. This image has too much gain. This image has too little gain. And this image is perfect. The near and far gain buttons adjust the brightness of echoes at different depths on the monitor. Sound waves become weaker as they travel through tissue, a phenomenon called attenuation. If the ultrasound machine were to show the true amplitude of the range of returning echoes, the image would become progressively darker from superficial to deep. This control allows the sonographer to adjust the brightness of the image at different depths. Usually the machine will have two knobs, one for the near field, meaning the part of the image closest to the transducer, and one for the far field, meaning the part of the image farthest from the transducer. The depth control is one of the most frequently used controls on an ultrasound machine. Adjusting depth is important for displaying only the necessary information. Often the deeper structures may not be of interest to a sonographer, and if the image is too deep, there is too much wasted space. Additionally, you may need to increase the depth to ensure all structures of interest are visualized on the screen. This image of the right upper quadrant has too much depth at the bottom of the image. There is a lot of wasted, empty space when the area of interest is at the top of the screen. This image has too little depth. Part of the area of interest is cut off. This image has perfect depth, not too much and not too little. We are able to focus only on the area of interest. The zoom function works by magnifying a desired section of a displayed image. The zoomed area often appears magnified, resulting in a pixelated image which can appear blurry. This function is especially useful for evaluating very small structures, such as the beating heart of a fetus or the common bile duct. In this image, the section of image underneath the purple box can be magnified using the zoom function. The freeze button is pretty self-explanatory. You will use the freeze function in order to freeze your image, to perform measurements or calculations, or to add text. Now let's discuss the various mode functions on our control panel. Using B or brightness mode, we see a two-dimensional grayscale image. This is a subxiphoid view of a heart with a pericardial effusion causing cardiac tamponade. The M mode function displays motion of echoes over time. This function is often used by emergency physicians to assess fetal cardiac activity. A narrow white line is focused over the structure of interest, and the machines map the echoes from that line through the tissue onto the vertical axis of a graph, while time is depicted on the horizontal axis. Most machines will display the M mode image under a smaller version of the original grayscale image. D mode, or Doppler mode, makes use of the Doppler shift, also known as frequency shifts, as sound reflects off a moving object, like red blood cells. Color flow, power Doppler, and pulsed wave Doppler are three important types of Doppler modes to know. Color Doppler is a technique for visualizing the velocity of blood, otherwise known as speed and direction of blood, within an image plane. To measure the velocity of blood, sound waves are transmitted into a vessel or through a valve, and the sound that is reflected from the blood is detected. Because blood is moving, the sound undergoes a frequency or Doppler shift. A color Doppler function measures the Doppler shifts. The way in which the frequency shifts are encoded is defined by the color bar highlighted in yellow. Located to the top left of the image. The color displayed at the top of the graph refers to the flow towards the probe, and the color at the bottom of the graph corresponds to the flow away from the probe. It is important to understand that red does not necessarily mean artery, and blue does not necessarily mean vein. Power Doppler displays flow without regards to the direction of flow. The power Doppler function is more sensitive to subtle movement, thereby showing slower flow. But this comes at the expense of more motion artifact. It is less affected by angle of the ultrasound beam relative to the direction of the flow than is color Doppler. Power Doppler is often used to detect testicular flow in patients being evaluated for testicular torsion, since testicles often have a relatively low blood flow. Pulse wave Doppler is used to measure the velocity of blood in a small sample of blood volume. The velocity of blood is displayed on the vertical axis of a graph, with the time on the horizontal axis. This pulse wave Doppler function is useful to use when evaluating flow within a vessel or through a valve. The arterial Doppler waveform classically shows pulsatile flow with wide variations in velocity, whereas the venous Doppler waveform shows continuous flow with slight respiratory variations in velocity. Last but not least, don't forget to save your images. If you have any questions about this tutorial, please feel free to ask Dr. Blackstock through email or during your next ultrasound session.